Hi, Mrs. Porter. Thank you so much for taking the time to talk with us today.
How are you? Thank you for having me.
We keep hearing the phrase mental health crisis to describe what's going on with youth in the country. So, do you feel like that term is right? Are we having a youth mental health crisis?
Yes, I agree with the term. I came in October of last school year. I was here 2 weeks and I had a caseload of 70 students.
Wow.
This year, we had to bring on another mental health clinician to help with the load. Daily, I hear things like, my boyfriend broke up with me, to I'm being abused. There's sexual issues. Kids are developing things they say, panic and anxiety, language that they normally wouldn't use, they're starting to use. There was a crisis already, but now that COVID-19 has come into all of our lives, now it's sort of like another thing on top, right?
Yeah.
How did that affect you, hearing all those kids' stories and what's going on in their lives and hearing how they're struggling?
Thank you for asking that, Zaida. I'd be lying if I said, sometimes I didn't go home and it was tough. But my job is to allow children to be heard and to help them to express their emotions. Here at Caesar Rodney, I do a coping skills group. For instance, today, I just said, tell me how you feel. Give me a word. You're not allowed to say good and okay. The young ladies, one lady said depressed. One lady said tired. One young lady said angry, fearful, frustrated. When we did a consensus, I missed an assignment. I slept for 2 weeks and now I have to play catch up. Does any of this sound familiar? No Zion from your
Absolutely,
own.
yeah.
We need to realize that sometimes we need to take a break,
I mentioned to the students a lot, in grad school, I received all A's one semester and 1 C+. And that C+ was an A as far as I was concerned. You know why? I earned it. There was a lot going on. I was still proud of it. I don't want anybody to say, oh, Miss Porter's telling the children to fail. I want you to pass in life. Because nobody will care about that A if by the time you get it, you're not feeling good about yourself. It's important that you handle your mental state, your physical state, and then the academic piece will come together.
Are you seeing a rise in certain mental health conditions among your students? I know you mentioned like anxiety and, depression, but are there any other?
I'm seeing a rise in substance abuse and addiction. Unfortunately, sometimes students they need hospital care. They need to go to a facility, that will help, get them off the drugs or at least give them a good start. This is an organ. If my heart starts to beat funny or skips a beat, I'm going to the doctor. I need this. Sometimes our organs misfire, and it's important that we get back on track.
What do you predict for next school year?
I predict next school year we will be ready. There will be more check-ins. I'm predicting that parents will be more open to resources, that we can have open conversations about race, about gender, about the pandemic, about mental health, about kindness, empathy, sympathy, because we've been disconnected and longing for connection. I predict that when we come together, we've learned something. We've learned how to treat each other a little bit better.
What gives you hope right now regarding teens and our mental health?
Well, I believe that young people are resilient. You've gone through a school year without being in school. You've gone through watching loved ones die. Just a lot of heartache. And so you're going to come back stronger. And you're going to use your voice. You're going to use your anger. You're going to use your strength to make a difference. The stigma of mental health will not be the same as in the past.
Yeah, I agree with that.
Absolutely.
It's great to just talk about how we're feeling and talk about mental health as a whole. That's really what we need to be doing, especially in a time like this. So thank you.
Thank you.